Welcome to NUS. You're about to embark on some fascinating work at the laboratories and workshops here at NUS, and we are sure you are excited to get started. Before you begin, let's talk about safety and health in laboratories. In NUS, we embrace safety and health as one of our core values, and therefore, we must all take ownership of safety and to make NUS a safe place to study, work, and live in. That means proactively thinking about safety and following safety rules and practices. This is especially important when you work in the laboratories, where you might be exposed to a diverse range of hazards. So how do you keep yourself safe while working in a laboratory? You need to follow the safety and health policies and procedures of the laboratory, which are derived from the risk assessment process. Risk assessments are an integral part of campus safety and are to be conducted before the commencement of any activities in the laboratory. The process typically involves 3 steps: identifying the hazards arising from the activities, evaluating and assessing the risk level of these hazards, identifying and implementing additional control measures to mitigate these risks. Let's take a look at each of these 3 steps in more detail. The first step in the risk assessment process is identifying the hazards present in an activity. A hazard is anything that can cause potential harm to you or others. Hazards can arise from the equipment that you use, the procedures that you do, or the agents and materials that you use. As you work in the different laboratories throughout the campus, you will encounter various types of hazards, such as physical, electrical, fire, chemical, biological, and radiation hazards. Once the hazards have been identified, the next step is to evaluate and assess risk levels. Risk level is the product of the likelihood and severity of the hazard causing injury or ill health to you or others. Let us use an example to illustrate this point. Glassware is handled frequently in laboratories, and a common hazard is broken or chipped glassware. Anyone handling glassware is at risk of cuts and lacerations. To determine the risk level, you would need to identify the factors that could influence the likelihood and severity rating of the risk. For example, the likelihood would be higher if the person handling the glassware is inexperienced, and the severity would be higher for an eye injury against a skin injury. Once the risk level is evaluated, the next step would be to determine additional control measures to reduce the risk level. In this step, we use the principles of the hierarchy of control to determine the reasonably practical additional risk control measures. According to the hierarchy of control, the most preferred control measure is to completely eliminate the hazard. For example, getting rid of clutter on a laboratory or workshop floor will eliminate slipping and tripping hazards. The second most preferred measure is substituting the source of the hazard. For example, using a chemical that is less flammable in an experiment will reduce the risk of a fire. The next choice of control measures is engineering controls. These are devices or barriers installed or incorporated into equipment or processes so as to isolate the hazards at its source. An example of an engineering control is a fume cupboard, which protects the user by extracting potentially hazardous vapors or gases. Another example is machine guards on equipment, which protect the user from moving parts or projectiles. Next on the hierarchy of control are administrative controls. Examples of administrative controls are laboratory rules, standard operating procedures, emergency procedures, and training programs. In NUS, Any staff or student working in the laboratory is required to undergo mandatory safety and health training. These include online university-level training, faculty, departmental, and laboratory-specific training. So do familiarize yourself with the training requirements of the laboratory that you are working in. The last and least preferred control measure is the wearing of personal protective equipment, or PPEs. Common PPEs such as laboratory coats, safety glasses, and covered shoes are often the last line of defense against hazards. Always follow the PPE requirements of the laboratory, which can be found on the signage posted at the door of every laboratory. Now that you have familiarized yourself with the risk assessment process and how the various control measures reduce or manage this risk, it is important that you do your part in implementing these controls. You can start right now by doing the following. Attend the necessary safety training before working in the laboratory. Keep yourself abreast with all the requirements of the laboratory safety manuals and standard operating procedures. Report any accident or incident to your principal investigator or supervisor immediately. You are also required to submit a report to the Office of Safety, Health and Environment via the online Accident Incident Reporting System within 24 hours. Remember the following emergency contact numbers. For more information about safety and health requirements for working safely in laboratories, please refer to the website of the NUS Office of Safety, Health and Environment. You can also get in touch with your laboratory's safety leads or supervisors for more guidance on health and safety. As a leading university in Asia, NUS is committed to maintaining a safe working environment for everybody. We invite you to embrace the NUS safety culture starting from today and to carry it on into your future professional careers. Let's work together to create a safe and healthy campus.